Much this morning, we're talking about physical therapy and rehab for animals who have experienced an accident or some sort of injury. Dr. Jerome Williams is a veterinarian who's a regular on our program. He brought along Dr. Cindy Grant to talk about this specialty. Good morning to both of you.
Good morning.
First of all, Dr. Williams, you talk about Pico here.
Pico is a young fella, 10 years old, and Dr. Grant's going to demonstrate for us some of those things we do with those dogs that are aged, injured, as you mentioned, the physical therapy, the chiropractic things. I see a chiropractor on a regular basis, and that can make a big difference with our animals as well.
Is that right? I mean, we don't really think about animals needing that kind of care.
It's pretty new in our field of veterinary medicine, and the reason that it works so well is that it addresses the neurologic system, our nervous system. And if you think of the nervous system as a hose, it communicates, say, from down here to the brain and back. If there's a kink in that hose, all the water can't get through. There's not enough communication. So in chiropractic, we sort of unkink that hose and allow that communication to flow.
And that actually helps them be more comfortable, right?
It does. It helps with pain. It helps them with their movement. It can help things like the digestive system and the immune system, because our nervous system actually has input into all of that, so it affects a lot.
So show us some things that might help.
So for him, it's very quick, and what I do is a head to tail examination. I just check his temporomandibular joint, and then we feel down the spine, and I actually haven't adjusted him in a long time, so I may find something. And what you do is you look for an area that doesn't move as well as it should, and it's very subtle, and I feel one right there. So we just get in and that's fixed.
Wow.
You go all the way down the back. You can check his pelvis, check his tail. You go through and check all the toes and the joints in the hind limb and his hip. You check the ribs, which a lot of people forget about, but that can be very painful if they're out of adjustment. And his sternum as well. And then I work my way back up. And in the exam, I take a little bit more time, but check his toes. There you go. You can sit if you want. And check the forelimb. And he's pretty good.
I can state clearly that it makes a big difference for me personally.
Oh, yeah.
So I can imagine how much more helpful it is for them.
Oh, most definitely. When you think about dogs, like you were mentioning, this dog likes to jump down and jump up, and that can sometimes, my dog is older, she's been falling down the stairs a little bit. So, yeah, I can see how this can help.
Yeah, it can help with balance issues as well, and a lot of older dogs experience that. A lot of my athletic dogs that come to me because they compete in agility or out in the field hunting, if they have some issues, this often helps as well. It doesn't take the place of good veterinary care, but it's a great addition.
Are there some exercises or moves that you can do with your dog at home that might help?
Yeah, there are some cookie stretches. Most dogs love treats. You can show a dog a treat. You can bring it down to the hip and have them follow it from side to side, which is really good for the spine. You can do that to the shoulder for the neck, side to side. That's good for the neck part of the spine. You can also have them do sit-ups and beg, and that's good for the core muscles here. When we think about it, when we do sit-ups here, it's the same thing. If he sits and then goes up into a beg position, that's really good for the spine.
And I've got pictures of Dr. Grant doing adjustments on horses.
Yes. Okay. Well, to find out more information, of course, they can always contact you, Dr. Grant, at Becker's.
At Animal Rehab and Fitness Clinic in Homewood, 977-7724.
All right. Thank you both for joining us this morning. Let's check in with J-Day.